Good evening, America. I'm Fox Wonder. Tonight on Impact Medical News, I'll be sitting down to discuss the most terrifying new pandemic sweeping across the nation. My guests, Dr. Pepper of the American Academy of Ulcerations and Dr. Seuss of the United College of Peptic Diseases, join me to share their knowledge about peptic ulcer disease, also known as PUD. Will it kill you and everyone you know? Stay tuned to find out. Dr. Seuss, Dr. Pepper, thank you for joining me.
Thank you for having us.
My first question is, what exactly is PUD and why should we all be terrified?
Yeah, I heard your introduction just a moment ago and really think it would be a good idea to start with some clarification. Peptic ulcer disease, or PUD, is not a terminal illness.
You mean it won't kill you?
That's right. In fact, about 70% of people with PUD don't know that they have it because they're actually asymptomatic.
Oh, that right there is terrifying. I could have this thing, I could be spreading it to my loved ones and I wouldn't even know.
Again, some clarification is needed. PUD is not contagious. You're not going to spread it like a normal virus. So let me explain. Peptic ulcer disease is when ulcers form in the upper GI tract. It affects the lining of the stomach and part of your small intestine, and it can also affect the esophagus. PUD interferes with the defense mechanisms of the stomach that protect the lining from hydrochloric acid or HCl. To make it clear, the stomach has a defense system and a digestive system. These two systems must work in balance to maintain that healthy GI tract. The defense is made up of bicarbonate or bicarb, which is a basic substance that neutralizes acid, and this protects the mucosal lining from becoming damaged by the hydrochloric acid. Prostaglandins are also part of the defense system. They regulate blood flow to the stomach and signal the inner mucosal layer to release bicarb. Prostaglandins also control the amount of HCl secreted in the stomach. The digestive system uses HCl interacting with the substance called pepsinogen to create something called pepsin. Now, hydrochloric acid and pepsin aid in the breakdown and digestion of food. When the defense system is damaged, it provides an opportunity for HCl to damage the tissues in the GI tract and also signals histamine release. And histamine then signals release of more HCl, which further erodes the stomach even more, leading to open sores in the GI tract.
I really should have studied some anatomy before taking this job. But if we could clarify, as I understand it, I could be having holes being burned inside me by acid and I wouldn't know.
Yeah, I think I could chime in here. Most nurses and doctors will perform what they call a head-to-toe assessment when they first encounter a new patient. This includes opening a dialogue with the patient, taking the report, and performing physical tests like palpation or auscultation. Included in a head-to-toe assessment is an assessment of the patient's abdomen. An abdominal assessment is the most helpful part of the overall assessment in diagnosing PUD. In the subjective part of the assessment, a clinician may rule out other causes of pain by asking about food intolerances. Additionally, subjective assessment of the stomach includes asking about abdominal pain, nausea, and vomiting. This can further pinpoint the location and type of pain to determine the potential cause. For example, acute pain may indicate perforation of the bowel, whereas chronic pain may occur with an empty stomach if the patient has gastric ulcers. Pain that gets better after eating also might indicate duodenal ulcers. However, if the pain gets worse after eating, this may indicate a gastric ulcer. Vomiting blood, or as we like to call it, metamesis, can also be associated with duodenal ulcers. The subjective assessment can determine if any medications or lifestyle choices are exacerbating the PUD, such as NSAIDs, smoking, or alcohol.
Yeah, but what if it's like a single malt scotch and really fine tobacco?
I don't think that matters. In general, smoking and drinking are very bad for your body. If I could return to what I was saying about the assessment, another part of the assessment is objective. A clinician might palpate the abdomen. PUD is often characterized by epigastric pain and rigidity upon palpation. In addition to the abdominal assessment, it's important to assess the client's skin as well. Pale, cool skin might indicate signs of anemia. This may indicate further complications of the ulcer, including internal bleeding. Overall, the subjective section is most important in diagnosis in addition to lab and endoscopy results. Objective findings may or may not be present. As Dr. Pepper mentioned earlier, some 70% of patients with PUD have no symptoms.
I gotta say, ladies, this is not going to do wonders for my ratings tonight. Excuse me, it's time for my supplement.
What you got there?
I got this from my trainer. It's supposed to help me with my love handles. It's called Helicobacter pylori. It's just awesome. You know it works because it tastes awful.
Actually, I probably wouldn't drink that. There are a few things that mess with the balance of your gut. We mentioned alcohol and smoking earlier, but another one is a bacterial infection called H. pylori. H. pylori can survive in an acidic environment like your stomach because it produces a substance called urease, which breaks down urea and produces ammonia and CO2. This will cause further breakdown of the stomach lining and either give you PUD or make it worse if it's already there.
Yeah, anyway, it doesn't sound like this PUD is all that terrifying, and we really need to give my audience something that they can watch tonight. I feel eyeballs leaving my screen.
Well, I don't really like terrifying people, but we could discuss all the other systems and organs that PUD can affect. There are many structures of the GI tract that can become damaged from this disease. The pylorus is a structure in the stomach that acts like a muscle to help squeeze food into the duodenum. With chronic ulceration, the pylorus can become scarred, which leads to a decrease in function. This decrease in function leads to gastric outlet obstruction. Gastric outlet obstruction occurs when food cannot move out of the stomach and leads to symptoms of feeling full early, bloating, nausea, and vomiting. Due to its symptoms, unintentional weight loss and nutritional deficiencies may occur.
Unintentional weight loss. I'm sure that's what my personal trainer was going for.
Yeah, maybe, I guess. Another complication of peptic ulcer disease is perforation. Perforation is when the ulcer eats entirely through the stomach or intestinal wall. This can cause severe pain, hemodynamic instability, and shock. There's also severe risk of infection with perforation. Peptic ulcer disease can also lead to internal bleeding, which can result in anemia and/or the requirement for a blood transfusion.
Now we're talking. Bleeding and infection. That sounds terrifying to me. Please, doctor, tell me, what will I look like when I get PUD?
Well, if you have or develop PUD, there will be things we call clinical manifestations, which include signs that we can see in the symptoms, which is what the person is feeling. In regards to PUD, the main signs and symptoms are indigestion and epigastric pain. Another important factor for the nurse or doctor to consider is the location of the ulcers in the GI tract. So there are differences in manifestations regarding gastric ulcers and duodenal ulcers. Patients with gastric ulcers may complain that about 1 to 2 hours after their meal, pain is heightened. This is what leads to weight loss.
There's that weight loss again, though.
Yeah, but I think there are healthier ways to manage your weight. As I was saying, those with duodenal ulcers, so that's the small intestine, whereas gastric ulcers are in the stomach, may claim that 3 to 4 hours after eating, their pain is actually better and they're not experiencing weight loss.
So no weight loss with the small intestinal ulcers. It's better to have them in the stomach.
Again, I really don't think you want this, Fox. Patients with gastric ulcers often state that they have pain that is dull and aching, and the duodenal ulcers can cause pain that is often reported as gnawing pain. Also, in severe cases of gastric ulcers, a patient may have blood in their vomit, whereas with duodenal ulcers, they may have blood in their stool.
Really, vomiting blood and blood in the stool.
Yeah, and the blood in the stool is a tricky one because most people realize pretty quickly they need treatment if they're puking out blood, but the blood in the stool often presents like it's black and tar-like.
You know, Fox, maybe you'd be interested in hearing about some of the treatment options out there.
I think that'd be a great idea, Dr. Pepper. My first question is, when can we expect to see a vaccine for PUD?
Well, Fox, again, this is not a viral infection, so there's not going to be a vaccine. The first thing your provider will probably recommend is a change in lifestyle. Things like smoking cessation, avoiding alcohol, avoiding NSAIDs, and getting regular exercise and eating a healthy diet would be a great place to start.
Well, that just sounds awful. How about drugs, in case there's people out there that don't like the whole exercise and not drinking thing?
Pharmaceutical interventions would include things like proton pump inhibitors, like Prilosec over the counter, to reduce HCl, multiple antibiotics to fight that H. pylori infection if it's present. And there's also a prescription called sucralfate that covers an ulcer and shields it from the damaging effects of HCl.
Good to know, doctor. My producers are telling me that's all the time that we have for tonight. I'd like to thank my guests, Dr. Seuss and Dr. Pepper. I'm Fox Wonder. I'll see you next time on Impact Medical News.